How are you going, David?
10 seconds. It'll be live whether or not it sticks again. Okay, it says that it is live, but it still says preparing. So I again think it'll drop out.
Well, let's
push
press on. So, Paul, welcome.
Okay. Thanks very much for inviting me to participate in this. I have just recently moved over to the Health Emergency Control Centre. I'm a doctor, I'm a public health physician by background, and disease control is part of our specialty. So it's our time in the sun. This is when you need public health physicians. I've actually been working as Executive Director of Medical Services, so as the Head of Medical Administration in Canberra Health Services for the last couple of years. And so this is, for me, coming into the Deputy Chief Health Officer role at the beginning of this week, is my return to clinical practice as we call on everybody to do what they can to stop the spread of the COVID-19 epidemic. So this is my clinical time, and I'm very pleased to be participating in this community forum. We'll be doing a meeting with a number of aged care people tomorrow, and there's one with GPs going on at the same time as this forum. So we've got a bit of explaining to do because the approaches for control of COVID-19 are pretty strenuous. I mean, I've been working in public health all my life. I've never seen anything like it. I think a lot of the community is in the same boat. Trying to understand the strategy and whether it's working and how it's working and what the government and the public health authorities are trying to do has not been easy. So I thought I might just try and tell the story of the COVID-19 response. And it's starting to get understood. I think we've had a tremendous communication effort by the Prime Minister and by the Commonwealth's Chief Medical Officer. I think we've had an extraordinary focus on it from the media, our own ACT Health Minister and the Chief Minister, and Karen Coleman, my good colleague, the Chief Health Officer, have been doing their best. But the ground has been shifting, and so they're not just telling the same story. The story has been changing quite a bit. So it started in Wuhan at the beginning of December, and I remember seeing reports of a new epidemic in Wuhan in December. Looking at the reports, this is part of my specialty as we look around the world and see what things are happening. And by Christmas, by early January, it was looking pretty important in global terms. There had been an amazing response by the Chinese scientists in discovering the virus and in sequencing it. Unprecedented response by the Chinese authorities to it to try and control the spread throughout China. And Australia was in a observational phase.